Good afternoon, everybody. Welcome to week 3 of Addictions and Dependency. I hope you had a good week off. Today we're going to be talking about Chapter 4, Pharmacology and Physiology of Drug Use. So to appreciate and have an understanding of how illicit substances affect the body, you need to have a little bit of an understanding of the field of pharmacology, which is defined as the interaction between drugs and living organisms, and also how this relates to the way drugs are administered into the body, absorbed into the body, distributed throughout the organ systems, metabolized, and finally excreted or eliminated. One of the factors that determines the effects of a drug on the body is the properties of the drug itself, whether its chemical composition is acidic or basic, what its primary ingredients are, and how active it is in the body, and also how soluble it is as well, water soluble versus fat soluble. Another factor in pharmacology of drugs is the way which drugs are introduced into the body, which we call routes of admission, routes of administration. The amount of drug needed to elicit a desired response is known as dosage. You also have to take into account the effects of other drugs in the systems that compete for receptors, which we'll talk about in a few slides. For example, certain asthma medications called rescue inhalers have their effects blunted when patients are taking certain medications called beta blockers for blood pressure. You also have to take into account an individual's previous experience with certain drugs. Take opiates, for example, and not meant literally. In medicine, we would be very, very cautious in prescribing narcotic pain relievers to someone who's never taken any type of opiate medication in the past. There's a term we call opiate naive, as opposed to someone who's had a history of opiate abuse in the past, may be very refractory to the properties of narcotic medications, even when it's needed for legit pain management purposes. So let's continue by talking about the various ways that drugs are introduced into the body. The most common way we think of is by ingestion, or swallowing and introducing medication through the gastrointestinal tract. This is probably the least efficient way of introducing a drug or medication into the body. When you take into account that substances are broken down by the digestive system and metabolized by accessory organs such as the liver and the pancreas, you have very little drug left than what was originally introduced. A very common means of introducing drugs into the body, especially in emergency medicine, is by the way of injections. That is, directly injecting or inserting the substance into the tissues of the body with the aid of a needle. A drug can be injected either into the fatty substance tissue, such as insulin, into the muscle, such as adrenaline or epinephrine, or directly into the vein, which is the most efficient way of delivering the drug into the system. The drawbacks of delivering these drugs by this way is the risk of introducing bacteria and infection. When we talk about IV drugs in particular like heroin, we'll discuss a little bit more about that. Drugs can also be administered via absorption, that is applied topically to the skin and slowly absorbed into the bloodstream over the course of time. Example of medications like this would be things like nicotine patches or narcotic pain patches such as fentanyl patches, which is used in the management of cancer pain. And finally, drugs can be introduced via inhalation. That is, they can be absorbed into the bloodstream through the respiratory system from the massive railway of alveoli passages that we have in the lungs, and allow that drug to be directly absorbed into the bloodstream. For example, sedational anesthesia. If you go on to take any type of medical classes, such as nursing, paramedic, prereqs for physician assistant, it's very important to have a little bit of an understanding of the nervous system to understand pharmacology, especially when we're talking about certain substance of abuse that have a direct effect on the nervous system. So the first body system we'll talk about is the nervous system. It's the most complex organ system in the body. It controls and governs all the processes and daily activity of the body, minute by minute. It consists of a very complicated network of structures, how you'll see here on this chart. To get a better understanding of the nervous system, please have this anatomical chart memorized as well as all the structures by next week's quiz. No, haha, I'm only joking. You don't have to do that. As sophisticated as the entire nervous system is, it really all comes down to this very fundamental structure called the neuron or nerve cell. This is the basic unit of the entire nervous system. Every organ in a nervous system, the brain, spinal cord, and all of your peripheral nerves consists of millions, if not billions, of these little cells. These structures are constantly communicating with one another. You can almost consider them like to be little mini microprocessors, and that's about as advanced as my computer knowledge gets. Although it's a little bit of an oversimplification, the basic structure of each neuron consists of three parts: the cell body, which integrates and processes all the information, the dendrites, which receive information from adjacent nerve cells, and axons, which distribute and transmit information to all the target organs being either another nerve cell, a gland, or a muscle, one of those three things. So when a nerve cell receives and transmits a signal, it does so by transmitting an electrical charge down its fiber. This charge is known as an action potential. Many drugs that affect the nervous system work to alter this action potential, either by enhancing it or inhibiting it. When the action potential reaches the terminal end of the fiber, it stimulates the terminal to release a chemical, which in turn crosses over a space called a synapse, and then attaches to a receptor on the adjacent structure. As I mentioned before, that adjacent structure is either a gland, a muscle, or another nerve cell. The chemicals that facilitate these reactions are called neurotransmitters, and there's several in the body. Neurotransmitters are chemical messengers that are very important for controlling almost every activity in the body. Many of your drugs of abuse directly mimic or inhibit some of the most important of these neurotransmitters. I'm sure everybody is quite familiar with the term adrenaline, or what's also known as epinephrine. Epinephrine is released into the nervous and endocrine system and is responsible for giving rise to that fight or flight reaction, which is an important responsibility of the sympathetic nervous system, which we'll talk about in a few moments. Stimulant drugs such as cocaine and methamphetamine directly mimic the effects of this neurotransmitter, giving rise to rapid heart rate and irritability. Noradrenaline, otherwise known as norepinephrine, is found in the central and peripheral system of the brain, and it helps bring about a level of awareness and concentration. Where in the peripheral nervous system, it also helps stimulate the fight or flight reaction as well. Very important neurotransmitter to understand and appreciate is dopamine, whose concentrations are found in various areas of the brain, and its main job is to enhance the feelings of pleasure and reward. The reward system is a very important mechanism for encouraging survival behavior. This is why, as a species, we reproduce sexually rather than asexually, to not just ensure the survival of an individual offspring, but to an entire species as well. It's also very important in the mechanism by which drugs produce addiction. All drugs of abuse stimulate the effects of dopamine, giving rise to that sensation of pleasure, which is a very powerful reinforcing mechanism, giving rise to dependence and addiction. Serotonin is a transmitter that brings about a feeling of calmness, enhances mood, and feelings of satiety after a meal. Many of your modern-day antidepressants work by mimicking the effects of this neurotransmitter. GABA, or gamma-aminobutyric acid, works to slow down metabolism and calm and give overall all mental and biological processes. Substances such as alcohol and certain tranquilizers like Valium and barbiturates mimic the effect of this chemical. Acetylcholine is a very important neurotransmitter because it's the main communication chemical of the peripheral and central nervous system. In the brain, decreased amounts of acetylcholine have been linked to conditions such as Alzheimer's dementia and many different functions. It has many different functions. For example, acetylcholine can stimulate the activity of skeletal muscles. However, it can also inhibit the function and activity of cardiac muscles. So it's a very complicated neurotransmitter. It's an excitatory neurotransmitter which helps enhance memory, cognitive function, and overall. When the body is withdrawing from certain drugs such as alcohol and benzodiazepine, that could be an overabundance of glutamate activity, which can result in severe withdrawal symptoms. Finally, the last neurotransmitter to talk about are endorphins, which I'm pretty sure people have already heard about. These chemical messengers. They help reduce perception of pain and discomfort, as well as bring about feelings of euphoria and pleasure. Many narcotic drugs, specifically morphine and heroin, are chemically identical to endorphins, which again bring about their addictive qualities. So let's go back at looking at the gross anatomy of the central nervous system itself. And anatomically, the nervous system is divided into the central and peripheral nervous system. The central nervous system consists of the brain, which processes all information, and the spinal cord, which works to help transmit information. The peripheral nervous system receives information from all five senses of the body and transmits motor responses. When a peripheral nerve branches off the spinal cord, it's broken up into two parts before it reaches its effector organ. The first nerve comes off the spinal cord, travels down the structure, and then comes to an end. The end that we spoke of is called the synapse, the little space between two nerve fibers. Then that information is transmitted down a second nerve fiber until it reaches the affected organ. Regions of the body where presynaptic and postsynaptic nerves come together are called ganglion, and consequently we refer to them as preganglionic nerves and postganglionic nerves. So when the brain or spinal cord transmits its electrical impulses by way of the action potential, down the preganglionic nerve travels all the way down the nerve until it reaches the axon terminal. Once that message reaches the axon terminal, a neurotransmitter is released, which we talked about before, into the synaptic space, and then stimulates that postganglionic nerve cell. Once that postganglionic nerve cell is stimulated, an action potential is transmitted down the secondary nerve to the affected organ. Before that secondary organ is stimulated, however, the nerve has to release another chemical across its border, and that's called a postganglionic transmission. The human brain is by far the most complex structure of the human body. Medical schools typically spend about 8 to 10 weeks studying the human brain alone, so what we talk about here by far is an oversimplification. So if you look at the gross structure of the human brain, it's divided into three major anatomical sections. The first of which would be the cerebrum, which is the outermost layer and the most developed part of the brain. As the human species, we have the most developed cerebrums out of all the animals on the world. Not necessarily to say that we're the smartest animals in the world, but this is the site where you have your higher cognitive processes, decision making, problem solving, emotional responses, and interpretations of your five senses. The next major structure is the cerebellum, which is sometimes referred to as the little brain, and its major functions involve balance and coordination of motor activity. Finally, the last and most important major structure of the brain, which unfortunately isn't really demonstrated very well on this slide, is the brainstem, which includes the pons and the medulla oblongata. This structure connects the brain with the spinal cord and is also the site for the initiation of respiration. An organism cannot survive without a functioning brainstem. You can actually take out almost half of a person's cerebrum and a major part of the cerebellum, and person can still live a somewhat functional life. Once you take out the brainstem, however, that is incompatible with life. The individual will die immediately. The reticular activating system, which is found deep within the inner brain and located in the brainstem, plays a vital role in the sleep-wake cycle. It helps you filter out information as it's entering the brain, which also allows for focus on important stimuli and concentration. Accessibility to drugs is very high, and the role of attention deficit activity disorder is very responsive to the use of stimulants such as Ritalin, Adderall, and some other chemical structures such as methamphetamine. The limbic system is composed of a variety of structures located within the center of the brain and works as the emotional center. It helps sort out memories related to emotion. When feelings and emotions are stimulated as a result of past experiences or memories of past experience, this activity is located in the center. It's also the center of the brain's reward circuit. Mentioned before, it's a very important mechanism for influencing addictive tendencies. The medial forebrain bundle is located along each side of the hypothalamus and serves as the communication route between the limbic system and the brainstem. The perception of sexual orgasm begins in the center of the brain and is also highly influenced by initial pleasurable effects of drugs such as cocaine and heroin. Again, it is this pleasure and reward system that is so heavily linked to the addictive behavior. The brainstem, as I mentioned before, is the most vital part of the central nervous system. It contains of two major components, the pons and the medulla oblongata, and it is directly connected from the thalamus, which is located in the midbrain, and creates a relay from the central nervous system into, or I should say from the brain, continuing along the central nervous system to the spinal cord. As I mentioned before, the brainstem is vital for initiation of respirations as well as other vital signs. It's the direct effect of medications such as narcotics and some barbiturates and tranquilizers, which depress the activity in the brainstem, ultimately uh, resulting in the death of an individual from basic suffocation. So as mentioned before, the peripheral nervous system serves as a transmitting agent that links the body to the brain and spinal cord and has two major components that control skeletal muscles and motor responses, as well as receives and relays sensory information to the central nervous system. And then you have the autonomic nervous system, which almost sounds like the word automatic, which regulates most of the body's involuntary responses, such as blood pressure, digestion, urinary functions, body temperature, as well as many other processes. It has two major components itself. It has the sympathetic nervous system, which is involved in the body's response to danger, or the fight or flight system, and then the parasympathetic nervous system, which brings the body back to normal resting state, which is known as the feed or breed or rest and digest system. These two systems, the sympathetic and parasympathetic nervous system, are always working in opposition at the same time. At some points of life, the sympathetic nervous system may take over a little bit extra, and some other times the parasympathetic nervous system takes over a little bit extra. And here's another diagram of the autonomic nervous system. Apologize, it's not too clear. But basically, activities of the sympathetic nervous system would be things such as dilation of the pupils to allow more light to come in, increased heart rate, increased blood pressure, decreased digestive activity, because in times of stress and danger, it's not really necessary to digest a steak. It's more important to run away and not become a steak. You'll also have enhanced blood flow to the skeletal muscles, as response to the parasympathetic nervous system, you really have the opposite activity occurring. Another response to the sympathetic nervous system would be opening up and relaxation of the bronchioles in the lungs to allow more air into the body. So the parasympathetic nervous system does just the opposite. It will result in constriction of the pupils because not as much light and attention is needed, slowing down of the heart rate, constriction of the bronchial passages, increased activity of the digestive system, and decrease or shunting away of blood to the skeletal muscles. So you have about 8 major organ systems in the human body, and we're going to talk about how certain drugs relate and interact with each one of these organ systems. First organ system to talk about is the endocrine system, which again, like the nervous system, regulates all the activities of the body, but it doesn't do so in such a quick time frame. Whereas nervous system activity is very quick and immediate, endocrine activity is meant for more of the long haul. It works by way of chemical messengers called hormones rather than electrical impulses such as action potentials. And here you can see a basic structure of the endocrine system, starting at the pituitary gland, or actually starting at the hypothalamus, which is located in the brain. The hypothalamus stimulates the pituitary gland, which is considered the master gland because it secretes about 8 different types of hormones to influence all other glands in the body, such as the thyroid gland, which is involved in metabolism, the pancreas, which helps aid in digestion, the ovary and testicles, which are involved in reproduction, the adrenal glands, which also helps in metabolism and fight or flight reaction. So certain drug stimulants such as cocaine and methamphetamine can cause things like an overactivity of the thyroid gland, which can result in elevated heart rate, sweating, nervousness, increased agitation, as well as increased activity of adrenal glands, leading to increased levels of corticosteroids and adrenal corticosteroids, which produces that adrenaline rush, leading to aggression and sometimes even violence. And just the opposite effects can occur if drugs such as narcotics and other sedatives, which can decrease the activity of the endocrine system as well, leading to decreased digestion, decreased sexual function, although you may feel that there's more desire for sexual activity, the individual find that the actual physical task is quite inhibited. The cardiovascular system or circulatory system consists of 3 major structures: the heart, the blood, and the blood vessels. And its job is to distribute oxygen and nutrients to every single cell of the body, as well as deliver waste materials from the cells of the body to the respiratory system. Drugs such as alcohol can directly damage the heart, causing enlargement and hypertrophy of the heart muscle, as well as stretching out and dilation of the heart muscle, which can lead to cardiac failure. It can also result in certain crazy rhythms of the heart, which can cause it to speed up very quickly and irregularly, something we call holiday heart syndrome, which we'll talk a little bit more when we talk about alcohol-related disorders. Cocaine can directly increase heart rate and blood pressure and can directly stimulate heart attacks even in young people with no other cardiac risk factors. And even such things as nicotine can affect the cardiovascular system. Nicotine tends to constrict blood vessels. It tends to inhibit the blood vessels' means of releasing anti-clotting factors. So that's one way in which nicotine can directly influence a heart's propensity to having a heart attack, or what we call in medicine a myocardial infarction. The respiratory system is responsible for bringing oxygen into the body for metabolism, as well as releasing carbon dioxide and waste material out of our body. As I mentioned before, death from narcotics overdoses usually occurs from decreasing the respiratory drive to the point where an individual basically suffocates. Combining depressants such as benzodiazepines with alcohol can also have a similar effect. Sometimes death occurs not necessarily from direct inhibition of the respiratory system, but from aspiration of stomach contents from vomiting, due to the increased ability to control their own gag reflex because of such a depressed level of consciousness. You may have, if anybody's a music history buff, you may have heard of certain rock stars back in the 60s and 70s who died by this means: Jimi Hendrix, Janis Joplin, just to name a few. The gastrointestinal system is responsible for introducing, breaking down, and absorbing nutrients into the body, as well as distributing them into the bloodstream. Alcohol can cause major damage to many organs in this system. Alcohol disrupts the lining of the esophagus, which can cause massive bleeding. Alcohol can cause inflammation of the stomach lining, causing gastritis and sometimes peptic ulcers, which in turn can also return to internal bleeding. Excessive alcohol use over the long term is also the #1 cause of liver and pancreatic cancer, as well as conditions called pancreatitis. Alcohol mixed with aspirin, as it shows here, can cause excessive bleeding in a very short period of time, and the two should never be mixed. So never take plain aspirin to try to cure yourself from your alcohol hangover. So various physical factors can also alter the way drugs are absorbed, metabolized, and eliminated from the body. Extremes of age can cause a wide presentation of varying effects on two substances. As we get older, uh, metabolism decreases and our ability to eliminate drugs from our body and the liver and the kidneys decrease as well. Women tend to metabolize alcohol less efficiently than men, probably due to a higher percentage of body fat and lower percentage of body water, whereas men usually demonstrate more aggressive behavior due to the effects of cocaine and methamphetamines. It's pretty obvious that the dosage of a drug plays a big part in the effects that that drug has on the body. The dosage is defined as the amount of drug that is consumed, whereas the threshold dose is the smallest amount of drug required to produce the desired effect. The effective dose is the amount required to produce a specific response. The lethal dose is death. One thing all drugs have in common is something called a therapeutic index, which is the difference between the effective dose and the lethal dose. The smaller the therapeutic index, the more likely overdose can result in death because of it. So also understand the issue with certain drug interactions. Some drugs just cannot be mixed. One of the things we mentioned was a combination of aspirin and alcohol, which can result in very rapid onset of bleeding peptic ulcer disease. And as it says here, an estimated 25% of hospital admissions result from some type of interaction between alcohol and other medications, such as maybe narcotics, tranquilizers, party drugs, you name it. Effects can generally be what we consider additive, antagonistic, or synergistic. So additive means that the cumulative effect of two drugs works better than an increased dosage of either one. Take, for example, for pain management, the combination of something like a non-steroidal anti-inflammatory like ibuprofen, coupled on top of maybe a muscle relaxer like Robaxin or Flexeril to bring about a greater sense of pain relief. Antagonistic drugs, drugs that negate the effects of each other. And I think I mentioned something like that before. For example, someone who has a history of asthma and takes an albuterol rescue inhaler for asthma attacks, the effect of the albuterol is to open up the bronchial passages. Certain blood pressure medications, such as beta blockers, reverse that effect, or they blunt the effect of albuterol. So remember that albuterol actually stimulates the effect of the sympathetic nervous system, and one of the jobs of the sympathetic nervous system is to open up the bronchial passages to allow for increased introduction of oxygen to the system to handle that emergency. And the purpose of a beta blocker is to try to bring blood pressure down, and one of the means of bringing that blood pressure down is to try to inhibit the effects of the sympathetic nervous system. So those two drugs can go hand in hand to kind of fight each other off. And a synergistic effect is when the combined effects of two drugs are greater than if they were just added together. Take, for example, something like heroin and Valium. The effects of both of them combined together can produce profound euphoria, profound lethargy, and profound decrease in mental status as well as respiratory status, resulting in ultimately death. Just a couple of other terms to be familiar with. The terms tolerance, we had mentioned probably on day one, comes in various degrees. So pharmacological tolerance means the body adjusts to the presence of drugs, meaning that maybe that same hit of heroin doesn't elicit the same pleasurable response anymore. So the individual who becomes addicted to heroin needs to get more and more doses at more and more frequent intervals to try to elicit the same response, which usually never happens. Behavioral tolerance means a person learns to adjust to the presence of the drug. So when they have more and more of that drug introduced in the system, they tend to compensate their behavior accordingly to try to fit in with normal society. To some degree, it may work. You may have heard the term functional alcoholic. That's a kind of a good example of someone who has a high level of alcohol in their system over a long period of time, but over the course of this addiction over the years, they've kind of learned to adapt to it and become somewhat functional in their day-to-day activities. Cross tolerance refers to people who develop a tolerance to a drug will develop a tolerance to chemically similar drugs. Take, for example, again, the opiate addict who's been taking heroin for the longest period of time and now is hospitalized for some major injury or illness that requires profound pain management and to become very refractory to pharmacologically mediated pain medications like morphine, Dilaudid, things of that sort. And then reverse tolerance refers to a drug user will feel the desired effects from lesser amounts. Don't really have a good example of how that occurs. I've never really experienced that in my clinical experience. So set and setting is very important when dealing with the influence of the effects of drugs. Set refers to the drug user's psychological makeup, personality, and mood and expectations when using the drug. For example, somebody who's trying to quit cigarette smoking and finds an increased desire to smoke cigarettes when they're in a situation that they're used to smoking in, like going to the bar or in certain social settings. Setting refers to the social and physical environment in which the drugs are taken, kind of refers to the same things. Placebos are inert substances capable of producing an effect. And I find this actually kind of interesting. May provide relief for 30 to 40% of the patients they are prescribed for. So take, for example, when the investigation of a new type of drug is being looked at. They'll take a population of subjects, maybe 100, 200, split them in half, try to weed out all the variable factors, and one group will get the active drug, the other group will basically get a sugar pill. So let's say you get a response in the active group of 40 people having a positive response and the placebo group having maybe a 10% response. That shows definitely an effective test trial for that active drug. But what about those 10% people that didn't get anything and responded to that drug? So personally, I think that's something that surely should be investigated because that's pretty profound. 10% people respond to a drug that not supposed to have any effect on the body. So what does that say? That says their body produced that own effect. So it definitely goes a long way in bringing about interest into mind-body interaction. So enough of that already. Let's just recap some of the most important points of today's presentation. So as far as pharmacology, understand the purpose of pharmacology, knowing a little bit about the mechanism by how drugs and medications affect the human body. And by doing so, you have to have a little bit of an understanding of the human body. Most important of the organ systems to kind of understand about is the somatic and the autonomic nervous system, as well as the central and peripheral nervous system. The major components of the brain, the cerebrum, cerebellum, the brain stem, and the more functional components of the brain, such as the reticular activating system, the limbic system, the periventricular system. Understand a little bit about how synapses work, along with the use of the major neurotransmitters, such as dopamine, serotonin, norepinephrine, GABA, glutamate. The major organ systems, such as the cardiovascular system, respiratory system, endocrine system, digestive system. The routes of administration, injection, inhalation, ingestion, and absorption. And then what we just talked about, the factors influencing drugs. And with that, please work hard, work on those study questions, your discussion questions, and we will present next week. Hope everybody stay well and stay safe.